Hello, my name is Kent Montgomery, and I work in the Healthcare Business Development Division of Consensus Cloud Solutions Incorporated, a soon to be announced public company spinning off from J2 Global. The Consensus Unite platform has been designed to work with your already established workflows. The tool combines all of your communication and document needs into one easy to use tool to assist you in getting the information where you need it most, at the point of care. Consensus Unite combines all of these tools into one easy-to-use package. It combines digital cloud faxing, which is based on the #1 cloud faxing solution, eFax Corporate. eFax Corporate is trusted by Fortune 100 organizations and is both HIPAA compliant and HITRUST certified. eFax Corporate enables a secure, cost-effective alternative to in-house fax hardware, boosting productivity and enhancing regulatory compliance. Direct secure messaging to send and receive patient data and CCDAs. Patient query capabilities through either data sharing networks or directly to a facility. And connectivity to HIEs, ACOs, and other healthcare facilities needed in patient care. You get all of this in Consensus Unite. How would you use Consensus Unite? At many of these facilities, for instance, during discharge, when a patient's discharged from a hospital, the instructions can be sent to a skilled nursing facility via direct secure messaging or cloud fax. A skilled nursing facility will also receive discharge instructions with data parsed and saved into a patient file in the EHR. If there's no EHR, documents can be managed into a document storage workflow. While receiving post-acute care, documents and queries are done via Consensus Unite and managed in the easy-to-use dashboard. When a patient is sent home and discharged from a skilled nursing facility with instructions, the instructions can be sent via cloud fax. Home health and durable medical equipment can receive discharge instructions through the direct secure messaging connection or via cloud fax. And documents can be viewed and managed in the Consensus Unite dashboard, all while querying for more patient data. And during ongoing treatment, the care team can receive direct secure messages and cloud faxes from labs, referrals, physical therapy, specialists, transitions of care, and are all queried for missing information. Data is parsed and put into the EHR. Why don't we take a few minutes and show you how Consensus Unite works?
This is where whoever is set up as your administrator will be configuring and applying the different component parts of Consensus. As you see here on the left, there are the 4 main areas of Consensus: request records, my intake, release, and find provider. I'll go through all of these and allow us to take a look at each and every one of those. We'll start first, where most everyone will start, is the intake section, the my intake. Think of the intake as your inbox. This is where everything that you're going to do comes back to or starts from Consensus Unite. You'll open up the intake and you'll see a selection of color-coded icons donating whatever this component part is. This is a CCD. We see faxes, we see the Adobe symbol for faxes, we see other types of faxes that are sent in with different kinds of files, and they're all marked by different icons. What I'd like to do is let's start with a fax. But this is a fax that we just received in the intake section, like anyone would receive any type. If I pull up the fax, I can use the thumbnail section and I can highlight the different pages and kind of review them. I see I've got a lab test report from Myra Jones, Peter Torkelson, and John Rudder. So from here, I know I need to be able to separate out this fax into the 3 different patients that the lab had sent the results over to this clinician. So what I'll do is I will first use the triage function. And in the triage function, I'm able to dissect and take apart the fax We saw that the first 2 pages, of course, were cover sheets. We don't need those. I can just go ahead and delete them. I will create just a different file folder name for the patients that are run the fax. So now I've labeled the file areas for the different patients that are in the fax, and now I will just associate the section so I can come up and look and see the lab result for Myra. And I will go ahead and associate that to Myra. This one will move over to Peter Torkelson. Move to John Rudder. Okay, so once I've dissected the fax, got rid of the parts that I didn't need, and I've created the file names as well as associated the pages to those individual patients, I'll go ahead and submit. If at any time I realize I've made a mistake, I can go ahead and use the reset button, and it will reassemble the fax back into its original state. Now it should take me right back to my intake section. And there, we've identified the fax, and now the single fax has now been broken up into 3 individual faxes that now I'm able to do something with as a clinician. So let's start with fax number 1 at the top. We see the name is carried over. I can go ahead and look at the results. Make sure that I'm giving it a birth date and identifying it as a lab result. And now from here, if I'm connected up to an EHR, I can upload the file into the patient's record of the EHR, or I can upload it into a secure section on the network drive. I would just export it, mark it as processed, task has been downloaded, I return to my intake, and I work on the next one. If at any time I want to check and verify the status, I can just look and see what I processed, and there I just processed the fax for John Rudder. You notice on the right, there are several rules that have been created for this organization. So I'm able to slice the intake section up and be able to create the rules, similar to what you would use if you were using an email program or an Outlook. I can then create those rules and be able to further process the intake section into making sure that the faxes or the documentations go to the right people to see them, and allow them to process it in their version of Consensus Unite as well. I can also take a look. Right here, you'll see a different type of a document. This is received via direct messaging. Direct messaging is included in Consensus Unite. So if you don't have direct, we'll make sure, and through your administrator, make sure that you get a direct address. So this is a CCD that I received, an XML file. It's always sent via direct. All the documentation and identification is already included in that, because that's how you will receive a direct message. So I can view the direct message and either use my beginning type of documentation. I can remove different pages, make it larger, smaller, or I can go ahead and use my CCDA Explorer and look at the various sections of the document. So if I was just interested in the medications, I can go to the medications file and read all of the different medications. If the section is empty, it'll identify it as empty. If I'm interested in immunizations, so now as a clinician, I've seen what I've needed to see. Now I can either do the same, I can export it into a section on the network drive, or I can upload it into the patient's record inside an EHR. I will go ahead and make sure that I identify the document. And I will export it or send it up to the EHR. Again, mark it as processed. And away it goes. I'll return to my intake, and I can select the next one. Now you notice the status of, on the right here, triaged, received, so you'll know exactly the status of the document at any given time. In case you're interrupted with patients or another task, you can always come back to the document or the intake section and pick right up where you left off. Or another person can go ahead and look at it and start working in the document and realize this is everything that's been done to it, this is what's teed up for next. Next section of Consensus Unite that I'd like to show you is how to request records. With Consensus Unite, you do have access to Care Quality. Care Quality has many organizations throughout the country, so to make sure that I'm searching, I'll first will search for the facility that I'm interested in. I've had three. I select the one that I'm interested in. Now, I will request the patient to see if they have any of the records. And I've got a hit. So now I can see what documents are available there. I see a discharge summary. I can go ahead and preview the document, again using the CDA Explorer. Or I can just go ahead and download it and send it via my direct address to the intake section. I keep track of all of my requests. And I'll go back to my intake and see if it's arrived. Not yet. Now, if I requested a facility and I found out they weren't a member of Care Quality, I can do another type of request. I can do a direct to the facility request, in which case I would just add the facility's name, ID, and if there was a physician or clinician that had a direct address, but I didn't know the direct address, I could use our Find Provider section. With this, I'm able to do a search. If I knew the zip code, or I can go directly to head the provider's name, I can search the provider's name to see if they have a direct address. Dr. Getwell, I'll go ahead and copy it. And I can add it, and I'll just fill in all the patient information that I have. Now, more often than not, I will have to attach a consent, and I can go ahead and send the request. This is for a facility that's not on Care Quality or Commonwealth. Now, once it's sent to that facility, someone at that facility will then turn around and respond back with the file or the information needed, since I've already attached the consent form. Another section is Consensus Unite gives you the ability to send faxes or direct messages for right inside Consensus Unite. So if I was going to send a referral, send it to and from, I can either send it to a direct address or I can go ahead and send it to a fax. I can attach the information. I can add any comments that are internal to me, so for any tracking or auditing purposes. And I can send the document to whomever I need to see from a fax. Again, I will track all the information here. If at some point someone says, hey, I didn't receive that fax, I can go into my tracking mechanism and just forward them the same information right back. But this time, perhaps I'll send it to the direct address. Everything's already there. I will just forward it. Again, I will track it and see that I've forwarded this message. Consensus Unite will let me know the status of all of my documents at any given time. The Find Provider section I showed you can use that at any point. You can use it in the release section or when you're requesting records. It can always come back to my intake to process the next document. And see, we received the CCDA from Caring Hands Village. I can process that next or start finishing the files that I had triaged. Those are all the major sections of Consensus Unite. Very, very flexible tool to be able to use in your clinical environment.
Consensus Unite will help you and your team be more productive, working in and streamlining your workflows. You'll be more efficient, quickly getting patient information routed to the right person. It's easy. You and your team can be set up and operating with minimal training, as the tool is very intuitive and it's proven. We are the leader in cloud-based digital data. Thank you for your time. Please visit us at consensus.com/unite.